Good morning, bonjour. My name is Anne Lagacé Dowson of the Canadian Health Coalition, and nous sommes ici ce matin pour exprimer notre inquiétude au sujet de la loi 11 en Alberta. We're increasingly alarmed by what's happening in Alberta with its Bill 11, and we've commissioned a legal opinion on the recent announcement of regulations overseeing Bill 11, which is the purpose of today's news conference. And our first speaker on this topic and on the topic of what's happening with regard to healthcare is Jason MacLean, who's the chair of the Canadian Health Coalition.
Good morning. My name is Jason MacLean, and I'm chair of the Health Coalition. Bill 11 is Alberta Premier Danielle Smith's plan to open the door to private, U.S.-style healthcare in Alberta. It creates a two-tier system where wealthy people pay to skip the line and get faster access to care while everyone else waits longer. Federal Minister Michel has raised concerns over Bill 11 with Alberta's Health Minister, Adriana Lagrange. On June 18th, Minister Lagrange announced Albertans will be faced with two-tier healthcare system beginning on September 1st. Today, we are making public the legal opinion of Bill 11 regulations proposed by Alberta, and it shows that they do nothing to bring Bill 11 in line with the Canadian Health Act. As you will hear from our legal counsel, Emma Phillips, these regulations will not remove or cure the harm of dual practice. In fact, of everything Alberta has announced, the only regulation actually enforced so far deals with record keeping and not with stopping the billing itself. Our legal opinion of Bill 11 is that it is a clear violation of the Canada Health Act and the worst attack on public universal health care that we've seen since the passage of the Act in 1984. This isn't speculation. In the Canby case, a 194-day trial with 150 witnesses proved in court exactly what dual practice does to wait time and access. The evidence is there already. Dual practice, or two-tier Medicare, or queue jumping, basically means this. Albertans who are on a waiting list for medically necessary care will be told by their doctors when they finally see them, you could pay me thousands of dollars now to get your surgery in the next month, or you can go back on the public waiting list. The UCP, Danielle Smith, and her minister, Adriana Lagrange, they're distracting us with the talk of guardrails and regulations, saying that they're open to the input from stakeholders and that they would make further adjustments. But what they're really doing is crashing the most important, beloved social program in Canada, our public universal healthcare system. We wholeheartedly agree with Prime Minister Carney, who told us, in America, healthcare is big business, but in Canada, it is a right. Private for-profit healthcare boosters are getting louder as they interpret the Prime Minister's silence as a green light for Alberta's two-tier healthcare scheme. We also agree with Minister Michel, who says that she is the guardian of the Canada Health Act. We're counting on the minister to live up to that role and to protect access to health care for all Albertans. But Minister Michel cannot do this alone. Withholding health transfers under the Canada Health Act ultimately requires Cabinet, and the Prime Minister chairs Cabinet. If Bill 11 goes unchallenged, that is Mark Carney's decision. That will be his legacy. The Canadian Health Coalition is calling on the Prime Minister and Minister Michel to do two things today. First, notify Alberta that Ottawa intends to deduct transfer payments for extra billing under Section 20 of the Canada Health Act. With this, there is no discretion. These dollar-for-dollar deductions are mandatory under the Canada Health Act. Second, we want them to open formal consultations under Section 14 through a ministerial notice of concern or a letter of warning over Bill 11's failure to meet the Act's core requirements. Alberta receives more than $7 billion a year in Canada Health transfers, which are delivered only on the condition that Alberta abides by the Act. Albertans go to the polls on October 19th to decide whether to take the first steps towards leaving Canada. If the Prime Minister enforces the Canada Health Act, he shows exactly what staying in Canada delivers for them. They deserve to know that the federal government will stand up for Albertans. ensuring that they had the same protections under the Canada Health Act as every other Canadian in other provinces, and that the federal government will fight for them. We're less than 8 weeks away from a rollout of American-style two-tiered health care, and 3 months away from a referendum on Alberta's future in Canada. The federal government cannot continue to remain silent on Albertans' right to public universal health care, just like all other Canadians. Thank you very much.
Thanks, Jason. Good morning. Bill 11 entrenches a two-tier system where those with the means to pay can access medically necessary services faster than those who depend on the public care system, and permits extra billing and user charges in direct contravention of the Canada Health Act. The law on this point is unambiguous. Since the Canada Health Act was first introduced in 1984, the federal government has repeatedly recognized that dual practice violates the Act. This is not a new or undecided issue. As Jason mentioned, in the Canby trial in 2020 and on appeal, the federal government repeatedly argued before the courts that dual practice contravenes the Canada Health Act, an argument that was accepted by the courts both at the trial level and on appeal. And that is because, as the extensive expert evidence in the Canby case showed, the experience of multiple jurisdictions internationally is that dual practice shifts our limited medical resources, doctors' time, operating room availability, allied medical professionals, into the private pay market. It incentivizes doctors to stream patients into their pay-for-service practice, and it creates conflicts of interest for doctors. The results are likely to be longer wait times and poorer health outcomes for those who do not have the ability to pay. And the federal government also clearly acknowledged in Canby that where a physician who is operating in the public sphere charges a patient for medical services that would otherwise be covered under the provincial health plan, that is considered to be extra billing or user charges under the Canada Health Act. Yet, despite the clear and consistent position of the federal government on dual practice, to date, the federal health minister has been largely silent on Bill 11, relying on the pretense that she must first review the regulations that will accompany the legislation. That explanation can no longer stand up. On June 18th, the Alberta government announced its intended regulations, although it should be noted that so far the only regulation that the government has actually passed is very limited, and it only relates to the record-keeping obligations of physicians. But even assuming that the government does ultimately put in place the regulations that it has announced, these regulations are expected to prohibit dual practice in limited ways in certain practice areas like cancer and emergency medicine, or they may require physicians to work for a minimum number of hours in the public sphere before they start charging for private fee-paying services. These regulations do not bring Bill 11 into compliance with the Canada Health Act. First, in all the other areas of medical practice where dual practice will still be introduced, such as in relation to medically necessary surgical procedures, the regulations continue to allow Albertans to be charged extra billing and user fees. They continue to permit some Albertans with the ability to pay to jump the queue, regardless of medical need. And they create inequitable access to health care for Albertans based solely on ability to pay. Second, even if physicians are required to work a minimum number of hours in the public system, Bill 11 still permits dual practice after that minimum hour requirement is met. And what's more, the minimum hours requirement only applies to physicians, but permitting physicians to provide medically necessary services on a private pay basis inevitably creates structural incentives to shift other critical health resources already in short supply into the private payment sector, thereby increasing wait times and reducing access in the publicly insured sphere.
Hear, hear.
But to be clear, it has been evident since Bill 11 was passed into law in December that nothing in any regulation can undo the fundamental harm created by the legislation. It is the very structure of dual practice introduced by Bill 11, which is inherently offside the Canada Health Act. The Alberta government has announced that it expects to start rolling out dual practice in September. And at this point, there really can be no more stalling. Under the Canada Health Act, the Ministry of Health is required, as Jason noted, to deduct amounts equal to the extra billing and user fees from federal health transfer funds to any province. Legally, under the Act, these deductions are mandatory. It is not up to the discretion of the minister. Minister Michel should therefore advise the Government of Alberta that once Bill 11 is implemented, the federal government intends to make the mandatory dollar-for-dollar deductions for extra billing and user fees from the federal health transfer funds. And further, given that Bill 11 violates the fundamental principles of the Canada Health Act, which are accessibility, universality, and comprehensiveness, and these are the conditions that the Canada Health Act makes requirements for federal funding, Minister Michel should initiate the consultation process, also prescribed under the Canada Health Act. But where a minister is concerned that a province is acting in violation of the core principles of the Act, they can engage in additional deductions over and above the dollar-for-dollar deductions resulting from extra billing and user charges. What Minister Michel cannot do is to continue to sit on the sidelines as Alberta prepares to dismantle Medicare when the Canada Health Act itself requires the federal government to act. Thank you.
Thank you.
You're here. Thank you. Melanie.
Hello, everyone. My name is Dr. Melanie Bechard, and I'm a pediatric emergency physician here in Ottawa. I am also the chair of Canadian Doctors for Medicare, a nonprofit organization dedicated to preserving and improving Canada's publicly funded healthcare system. As someone who is currently working full-time in an emergency department, I am all too aware that our system needs to change. None of us are here to defend the status quo. Too often, I see young patients, children, who are desperately waiting for surgeries, who come to the emergency department with medical complications related to their delayed treatment. But let me be clear. The solution to this issue is not dual practice. Currently, in every province outside of Ontario, physicians have the option to either work exclusively in the public system or opt out and charge patients privately. Very few physicians outside of Quebec choose to do this, simply because there's not much of a business case for it. It is a risky financial decision for physicians to charge patients for something that they could access for free. Dual practice allows physicians to bill the public system and to charge patients privately, simultaneously, in the same day in the same clinic. This provides a financial safety net and provides a huge incentive for physicians to leave the public system. Dual practice will not solve our wait time issues because the bottleneck is our healthcare resources, our human resources and facilities. We're not adding any new physicians, healthcare providers, or hospitals. We're just drawing away the limited physicians we have from serving those on the public wait lists. As we've seen in Australia, creating a two-tiered system does not shorten wait lists. It rearranges them so that those with more money are seen first, while the majority of patients wait even longer for care on the public wait lists. I am, without exaggeration, terrified of what Alberta's dual practice legislation will do to Canadian healthcare. Alberta is creating an environment where wealth trumps medical necessity, where American-style private insurance will flourish, and where the majority of patients will have to wait even longer for care. Better solutions exist. Proven strategies like team-based models of care, centralized intake referral systems, and even changing payment models to maximize efficiency in our public hospitals so that surgeons are able to access OR time have all been implemented in certain Canadian jurisdictions and abroad with good proven results. On behalf of Canadian Doctors for Medicare, I join my colleagues in asking Minister Michel to enforce the Canada Health Act to its fullest extent. Please take immediate, real-time, mandatory deductions, dollar for dollar, whenever a patient is charged for medically necessary care, so that Alberta and any other provinces or territories considering similar measures are made aware that it is not tolerated in a Canadian healthcare system based on evidence, equity, and efficiency. As has been said, Albertans deserve the same protection under the Canada Health Act as people all across Canada. We also ask Minister Michel to please initiate Section 14 to take discretionary penalties for failure to comply with the Canada Health Act. We do not need to wait decades for Alberta's data to tell us that dual practice negatively impacts accessibility, equity, and wait times when evidence from around the world already demonstrates this. And please, Prime Minister Carney, support Minister Michel in enforcing the Canada Health Act. No one wants their legacy in federal leadership to be the one that lost Canadian Medicare, a source of national pride that is truly admired across the world. Let's work together to focus on complex but proven solutions to build a better healthcare system. Thank you.
Good morning. My name is Laura Zarco with Action Canada for Sexual Health and Rights. As we have heard already, we are here to talk about what is at risk with Alberta's Bill 11. This is not a simple debate about healthcare delivery or only about Alberta. It forces us to ask some fundamental questions. Who do we want to be? Do we want to remain the Canada that proudly guarantees healthcare to every single person regardless of job, income, or postal code? Or do we surrender to a system in which your health is determined by your wealth, and life-saving care belongs only to those who can afford the price? For people seeking sexual and reproductive health care, the answer is clear. Sexual and reproductive health and rights depend on a strong public healthcare system. Weakening public healthcare weakness access to abortion care, gynecological surgeries, and treatment for endometriosis and other chronic reproductive health conditions. It also undermines timely sexual health services, including STI testing and treatment, as well as cervical cancer screenings. When access to essential care depends on the ability to pay, we put individual and public health at greater risk, and we create new barriers to essential and timely care. These barriers fall hardest on those already facing challenges: young people, workers in precarious employment, newcomers, survivors of domestic violence, and families struggling to afford groceries. These are the people who cannot simply pay their way to the front of the line. Bill 11 creates a two-tier system in which timely care increasingly depends on the money in your pocket rather than your medical needs. That is not universality, that is not accessibility, and it is not the promise of the Canada Health Act. We all recognize that Canada's health system is under strain, and we all want shorter wait times. We are told privatization will achieve that, but the evidence is clear. Countries that have introduced parallel private payment systems have not reduced wait times for everyone. Instead, privatization draws health professionals and resources away from the public system, increasing wait times and deepening inequity. Universal healthcare is one of Canada's greatest strengths. It reflects our belief that dignity, health, and opportunities belong to everyone, not only those who can afford to pay. To the Federal Minister of Health, our message today is simple and clear. The Canada Health Act exists to protect universal, accessible, and publicly funded healthcare. Bill 11 undermines those principles. The federal government has both the authority and the responsibility to enforce the Canada Health Act and protect the rights of Canadians. This is a defining moment. At a time when sexual and reproductive health services are already underfunded and reproductive rights face growing attacks worldwide, Bill 11 represents another assault on reproductive rights. The answer we are looking for is not privatization. The answer is to invest in public health care, to invest in sexual and reproductive health, to invest in the social programs that allow people to live with dignity. Because health is not a commodity, health is not a privilege, health is a human right, and reproductive health is an essential part of it. The Canada we're fighting for is one where no one is denied care because of the money in their pocket. That is the future we should be building. Thank you.
Thank you.
Hi everyone, I'm Chris Gallaway from the Friends of Medicare in Alberta, and we're back here in Ottawa today to call for leadership from our federal health minister. Because what we have in Alberta is a provincial government steamrolling ahead with implementing two-tier American-style healthcare in our province. We're starting in September. We'll have a system for surgeries where the wealthy can pay to skip the queue, and everyone else will be left waiting even longer. And at the same time, they're implementing a market for private insurance to profit off of this medically necessary health care. This is an American approach to healthcare that's being implemented. It's not about European healthcare or evidence worldwide. We are full steam ahead with American healthcare coming into Alberta. We think it is unfair and un-Canadian, and it is a clear violation of the Canada Health Act, which we've heard today with the legal opinion that looks at the regulations and legislation from Alberta. This is a wholesale violation of the Canada Health Act, and regardless of whether Alberta implements some more regulations before September that they've promised, it will not change that fact. We're at the point where we need clarity from our federal health minister. She needs to say clearly that what is happening is a violation of the Canada Health Act, and she needs to say she will enforce the act if Alberta proceeds in September with this plan. That is the clarity and leadership we are seeking from our federal government, because we know the silence to date in the 7 months since this legislation was passed has been interpreted purposely by those seeking to privatize and profit off of our health in Alberta as consent for what is being implemented in Alberta. So we need that federal leadership to say with clarity, this is a violation and it will not stand, because Albertans deserve the same protection as all Canadians when it comes to access to universal health care. And it's not just about leadership around the Canada Health Act, but what we really need to see from our federal government is leadership on health care. To recognize this as a nation-building project that it is, our universal Medicare system, and to really step up to support solutions in our public healthcare system when it comes to wait times, capacity, workforce. We know there are issues, we know things need to change, and that means our federal government needs to come forward along with our provinces to implement solutions in the public system that we know work, rather than a system where the private system is there for those who are wealthy and everyone else is left waiting even longer. You know, there's a premier's meeting happening in PEI next week. What a perfect time for our federal government to step forward with clarity on how they see the Canada Health Act, with how they see Canada healthcare moving forward, and show some leadership on solving the issues in our public healthcare system. Thank you.
So we would open it up to questions if there are any.
We don't have any questions at the moment. If there's anything you'd like to add.
Thank you.
Sorry, one more thing from Dr. Bechard.
Okay, perfect. I wanted to build on what my colleague Chris Gallaway from Alberta has spoken about, because when folks ask me questions about Alberta's plan for two-tiered healthcare, they ask, won't it be more of a European model than American-style healthcare? And I think there's a lot of caveats we need to consider with that. One of the common comparator countries is Germany. Germany does have a concurrent public and private system, but there's a lot of restrictions that help to mitigate the ill effects of dual practice. For example, in Germany, patients are either registered with the public system or pretty much opted out entirely into the private system. This is very different from what exists in the States and seems to be very different from what's being proposed in Alberta, where patients might be charged publicly for some services and privately for others, with different doctors in the same day. So there's a lot more mixing of public and private with what's being proposed. I think when we compare to European or other high-income countries, we also need to keep in mind that we are truly comparing apples to oranges, and there's a number of other variables that can lead to other health systems having better outcomes. I think a lot of these health systems succeed in spite of dual practice rather than because of it. So if we look at a lot of high-income European nations, about 80% or more of health spending is from public sources. Simply put, the government is investing more into their health care. In Canada, we're at around 70%. So if we really want to have European-style healthcare, I'd say let's not take the bad parts of dual practice. Let's look into the advantageous parts like pharmacare, which every high-income country that has universal healthcare also includes. Canada is definitely an outlier in this sense. We also saw testimonials during the Canby Surgeries Corporation trial, where experts from around the world had actually lauded Canada's decision to avoid dual practice, and that there's many healthcare experts from different countries that admire that and recognize that dual practice has actually been a disadvantage to their system in many ways. Again, when Australia rolled out their two-tiered system, waitlists overall did not change. They got shorter for those who could pay, but longer for the majority. It averages out. So it truly is not a solution to our issues. I also encourage everyone to look at the data for what exists in different countries. And I was actually shocked recently when I was studying some recent OECD data on surgical wait times and found that for certain surgeries, when you look at the time from consultants to when the surgery actually happens, Canada's actually at or below the OECD average on many metrics. Now, I do think we should aim higher. I know that this is small comfort to many patients, many of my patients who are waiting months for surgeries. This should not happen in a high-income, well-resourced country like Canada. But we need to, again, look at real, proven solutions rather than dual practice. I think we all know that there is no country in the world that is a utopia for healthcare. Everywhere is facing wait times. This is a big struggle in many places, and dual practice has just not been an evidence-based, proven solution. So I'd encourage everyone to keep in mind that in Canada, we are geographically culturally, language-wise, much closer to the United States than some of these other countries, and it would be a much easier market for United States-style insurance companies to move into. So for those reasons, I am very concerned that the dual practice legislation in Alberta will issue in much more of an American-style healthcare system rather than what exists in other high-income Western nations.
Thank you, Dr. Bechard. Thank you to the press gallery, and thank you to our speakers today. If you want further information, you can find us all online. We'd be happy to correspond with any and all people who are interested, and if there's any media requests, please contact me. Merci à tous et à toutes.